Will stress cause fever? Have you ever wondered if stress can actually make you feel feverish? Let's explore this together. Stress is a common part of life, and it can affect your body in many ways. One of the interesting ways stress can impact you is through something called psychogenic fever. This is a type of fever that is not caused by an infection or a physical illness, but rather by psychological stress. Psychogenic fever is more commonly seen in young women and children, but it can affect adults of all ages as well. When you're under a lot of stress, your body's stress response can trigger a rise in your body temperature. This can happen suddenly, with temperatures rising as high as 105 degrees Fahrenheit, or it can be a low-grade fever that persists over time, usually between 99 to 100 degrees Fahrenheit. The mechanism behind psychogenic fever is not fully understood, but it's linked to the body's stress response, particularly the sympathetic nervous system. When you're stressed, your body goes into a fight or flight mode, which can increase your body temperature. This type of fever is different from the kind caused by infections because it doesn't involve inflammatory mediators, which are usually present when your body is fighting off a virus or bacteria. One of the key things to note about psychogenic fever is that it doesn't respond to the usual fever-reducing medications like ibuprofen or paracetamol. Instead, it often responds better to medications that treat anxiety and depression, such as anxiolytics. Therapeutic approaches like relaxation techniques, psychological therapy, and creating a calm environment can also help manage this type of fever. In some cases, psychogenic fever can be triggered by specific situations or events. For example, a person might develop a fever only when they are in a particular stressful environment, like school or work. The fever can last from a few hours to a day, but if the stress is chronic, the fever can persist longer. Symptoms of psychogenic fever are similar to those of a regular fever, including elevated body temperature, chills, weakness, and fatigue. However, the underlying cause is purely psychological. So, to answer your question, yes, stress can cause a fever, but it's a special kind of fever known as psychogenic fever. Managing this type of fever involves addressing the underlying stress and using appropriate therapeutic methods to reduce stress and anxiety. If you find yourself experiencing frequent or persistent fevers without any clear physical cause, it's a good idea to consult with a healthcare professional to determine the best course of action.